Welcome to Kevjet the podcast. Dr. Mike Brandt, facial plastic surgeon based in Toronto.
Thanks so much for having me.
I've been looking forward to this conversation since I've had this email pop up in my inbox saying you need to speak to this guy because he's fascinating. So you're not going to let us down, are you?
I sure hope not. That's a high bar, though.
I guess my first question for you is, as we open the conversation, is just when you were a kid, did you imagine that your career would involve changing the way people see themselves when they look in the mirror?
Yeah, not at all. Yeah, I had no idea that this would be sort of where I ended up and the impact I would be having on kids. I mean, as a kid, I liked playing with Lego. I liked architecture. I liked building things and figuring things out. And then, I was sort of inspired by my grandfather. He was a family doctor, and watching him and seeing, wow, all these people really were impacted by their interaction with him and felt better. And, I was like, wow, medicine is kind of cool. And then that sort of embarked my interest in looking into healthcare and medicine.
What is the proudest part that people don't see on your CV, I guess, is the best question.
Yeah, I guess, the thing that they don't see on the CV and the part that I'm most proud of is sort of the individual interactions with patients every day.
Yeah.
And it doesn't matter how big or small the procedure is. Sometimes it's a minor thing that has a big impact to that person. I fondly recall I had a patient who had a facial scar after a traumatic injury, and we just did some work to improve her scar. And it was sort of minimal from a complexity perspective, but really maximal from an impact. And she was grateful, and it really made a difference to her life. And being able to sort of impact people in that way and make a meaningful difference for them, that's not something that you can sort of list in any credential or CV. It's just something that happens on a day-to-day basis.
So you've trained under some incredibly respected surgeons. What is one lesson from one of your mentors that has stayed with you throughout your career?
I've had some amazing mentors, and they've each provided me with different things. And, you sort of hear their voice in your head as you're doing different things surgically or interacting with patients. You sort of hear them talk about things and how they do things. And it's sort of funny how that impacts. But, really, I would have to say during my fellowship, I spent some time with Shan Baker, who is sort of like, the godfather of reconstructive facial surgery, wrote the textbook, and he was just an amazing icon who I got to spend time with towards the tail end of his career. And he was very, very insightful in, always try to take care of your patients as family, and you're really trying to deliver the maximum impact on that person for what they're desiring with the least amount of risk and complication and everything else. And just because a new procedure is on vogue and people are doing it might not always be right for that particular individual, and you want to sort of cater your practice to taking care of them.
With all your training and continued training, are you very disciplined or are you just unable to sit still?
I have ADHD. My kids have ADHD. This is sort of, yeah, a lifelong battle. Yeah, no, I'm not able to sit still. I'm constantly moving and changing. And it's one of those things that I really like about my field is that things are always changing and adapting. There's always an opportunity to learn more and improve upon yourself. I mean, the learning is never done. The surgeon who stagnates is a disaster for their patients, really. And we're always trying to up our game.
What does a surgeon learn about people that the general public would never ever understand?
People are strange. I mean, in general, right? Like we all have meaningful interactions with significant others and everything else, but you really don't get a true honest feel for people until they're sort of in a situation of stress, right? And that's where you really sort of the person is revealed. And that can happen through a variety of different ways. It can happen through healthcare issues, it can happen through their recovery, and you really get to interact with them at a different level. And that interaction creates a bit of an intensity in your relationship where now you are drawn together and you've made a major impact for them for the rest of their life.
Do you find yourself analyzing people as soon as you meet them, even if you're just out in the general public?
Not typically. I can, there are certain things that, I mean, you're seeing when you're walking down, the supermarket, right? And I joke with my patients that there's a supermarket test. If somebody can see what you've had done from across the room at a supermarket, then that's not they didn't have the right person doing their procedure, so to speak, right? So that's what I'm noticing is what everybody else is noticing, that things are overdone or a little bizarre. But in general, social interactions, I'm not typically sort of looking, I need to fix this or fix that, or we can make that better. It's getting to know the person and interacting with them.
I come from a nursing background, and I find myself on the tube, and especially if people have their arms up and they're holding a rail, and I'm always like, "Look at those veins. That would be the best patient to take blood from." And it's funny because if you go out with like our group from that are all nursing, it's like we all look at each other, and it's like people would think we're like checking them out, but we're actually checking out their veins.
That's funny. I mean, certainly when we're interacting with people and if somebody brings up the question, then yeah, we can go over sort of what are opportunities for them and things to enhance. But I try to keep the doctor mode separate from the social mode.
What has your work as a plastic surgeon taught you about human insecurity?
So that's the realist really the biggest impact we have on people. So I jokingly say we're in the realm of psychiatric surgery as opposed to psychiatry, right? Like I have the opportunity through surgery to really restore somebody's confidence, something that bothers them and has bothered them forever, and really they're deeply impacted self-conscious wise and everything else, and we have the opportunity to make a major impact on that and make them feel sort of better about themselves. So really that's sort of the intersection where we're really be able to, that's the real sort of crux of the discussion when we're meeting in consultation, is not about the facelift or the eyelids or whatever. It's about making you feel better about yourself and feeling more rested and feeling like you're representing what's happening on the inside to your outside.
People often say they want to look younger. What do they really want when they sit down in front of you? Do you think they really want to look younger?
I don't think they want to look younger. I mean, patients in general and people in general, you go through life, you pick up battle scars, you're dealing with things throughout life. You want to look better. You want to look rested. You want to look like yourself. Yes, to some extent, people are like, yeah, I wish I could look, like I did when I was 20, right? But they're realistic. They're not sitting there going, we got to correct every last wrinkle. Most patients are very reasonable when they're sitting down in front of you. They just want to feel like themselves, only a little bit better. We want to get rid of the wobbly neck. We want to lift up those eyelids. We want to sort of make myself look better so that when I'm interacting with my peers, I look like them. I look good. I look rested, is really sort of where they're at.
Have you ever had a patient who was asking for one thing, but you quickly realized they wanted something completely different?
Yeah. I mean, we get that all the time. We got to switch gears. So
How do you approach that?
part of it is social media driven, right? So people are watching all these crazy things on social media, bizarre before and afters. Most of them aren't real. And then they're coming in with this false perception of what's possible. And then you really have to have an honest discussion with them about what's real and what's not, and what we can deliver upon, and really what they want to see, as we were talking about before, what they want to see at the end of the procedure. And sometimes that has nothing to do with, injectables. Sometimes that really has to do with surgery. And then we have that switch of conversations.
What do you say to someone who's convinced that one procedure will completely change their life?
They need more than that procedure. I mean, really, it's bad timing to think about any sort of procedure during major life events or correlating a surgery with a overall improvement in your life, whether that's, social interactions, whether that's being, able to create relationships, whether that's improvement in the workplace, any of those things. It's really about restoring yourself and your self-confidence. And then maybe there will be correlates that sort of extend out into those other interactions. But I very much correct patients who perceive that this change is going to have a major impact on their overall life. Like, we really have to set expectations and talk about that, because that's really where we end up doing a procedure and afterwards they're dissatisfied, like, "Oh, I wasn't able to create that relationship. People aren't knocking down my door for my phone number. Like, what's going on? This is where my expectations were, and we're just not meeting that."
How often do you have to have the conversation with the patient and tell them, maybe this surgery just isn't for you. Maybe this isn't what you need.
Yeah, I mean, it happens. It happens in two different ways. Sometimes it happens with they come in with a set agenda where they think they need something and they don't really need that, or it's not the right procedure for them. And then it's sort of revisiting, what is the right opportunity for them, I think is sort of the main take on that. As far as, the other part is some people just aren't psychologically ready. Like we talked about before, they're going through some major life crisis and they're looking at this as their out, and it's just not the right time. And we really have to sort of narrow it down on when might be the right time and sorting out where they are with their life currently and having that conversation.
What concerns you more? Someone who wants a small, subtle change, or someone who wants to completely reinvent themselves? And I think I know where you're going to go after this, what we've already just spoken about. But
Yeah. I mean, anybody who wants a life altering change, I mean, it's a big ask, a big challenge, and we really sort of have to revisit what we're doing.
but are
But
there
some,
those? Are those? There must be those patients that have waited years and years and years, and they're like, okay, I'm finally ready to have everything done at once.
right. And in that circumstance, it's challenging because we look at, I frequently will use sort of the house renovation analogy, and it's like, you know what? You sort of let the house go for 40 years and you're coming in and you're asking me to paint the walls where really we're going to need some major structural changes. And because we've sort of let it go, there's some things that will require a lot of intervention to make better. And it might not be completed in one single surgery. We're going to be looking at the long-term strategy as far as trying to make things better. So that's really the biggest thing in that circumstance. And again, it's aligning sort of expectations with sort of what's realistic as far as outcomes. And that's the conversation we have. I mean, conversely, the discussion of a small, subtle change, sometimes that's really challenging too. I mean, we get patients who come in who've either had a bad experience having surgery elsewhere, and now they're looking to improve things, and they're willing to accept sort of any subtle improvement compared to what they had before. And that's a great patient. Conversely, we have patients who are really like amazing right now, and they want this subtle little tweak. And in general, the conversation we have there is like, you know what? You're a 99% right now. You want to get to 100. It's really hard to go from 99 to 100. I think sometimes we have to wait until you're like 90%, and then we can make that more meaningful impact on your life, right?
Isn't it interesting that the patient or the person, I mean, I can put myself into that category, will notice that 1%. That's the 1%. That's the part that just drives you crazy.
Yeah. Yeah. And that's the challenge, right? It's like we're all noticing these things and we're all, you can't fight gravity, you can't fight aging, right? I mean, the alternative is you're underground, right? Like it's the reality. So yes, we will notice these things. And when they bring it up, we have the conversation. And if it's obviously apparent and I notice it and they both notice it, we acknowledge that it exists. But what's going to be involved in trying to create that and what's the balance of risk and benefit is really where the conversation comes down. Like, what if we did this procedure and now things are way worse? Now we've created a small problem and made a bigger problem. Like, where are you going to be in that scenario? How is that going to impact on your life and feeling self-conscious about, the bigger problem? And sometimes when you're correcting all of these small problems, you end up creating one big problem. And that's a line from a colleague of mine, Dr. Bentale, but it's a legit line in that, sometimes you have to accept these minor imperfections.
Definitely. Do you think society has become more accepting of cosmetic surgery, or has it become more obsessed with appearance?
I think it's a combination of the two. I think, Zoom, like we're on now, all of the teleconferencing, working from home, looking at your face constantly has its impact on people, right? Like, we had that whole thing during COVID where people were looking for subtle tweaks because they were just tired of looking at themselves on Zoom all day, right?
Yeah,
So that's a legitimate concern. But thankfully, in general, people are more accepting of aesthetic surgery these days. The taboo is sort of being lifted a little bit. People are ready to accept that, what, if I want to look better or feel better, there are options available to me and I don't have to hide them. And I think people socially are discussing their interventions and discussing things a little bit more. And I think that openness is a good thing.
how do you see, is there a trend, I guess? There's a couple questions that have just popped in my mind randomly, but do people come to you with filtered photos saying that that's what they want to look like?
Yeah. So, in the past, there were a lot of celebrity photos that they would bring in, or they would bring in pictures that they see elsewhere. I want to look like this. I want to modify. I want to be like this. And now, yes, they're using filtered or their own doctored photos, and they're modifying what they would like to see. And then it's, in a way that's better because it's still them and we're still able to do that. But to some extent, it's still just sort of trying to figure out what's realistically possible, because there's structural things that can't change, and there's things we just can't modify, and we have to sort of find what's the right balance for them.
Are you finding, is there a trend in younger patients coming to see you now?
There was for a while, and certainly like around the COVID time and everything else, there were a lot of people, I guess, and maybe it was sort of that whole Zoom thing, and people on FaceTime, whatever, they were coming in and they were asking for more Botox and fillers. I think part of that is sort of weathered the storm, and people are coming out a bit ahead of that. There is still a little bit. And I think people are definitely still coming in for prevention. So they want to know, what can I do? How can I optimize my skin? What can I do to prevent all these problems long term? And how can I optimize things now? So we are seeing sort of that flip side, as opposed to sort of people coming in for quote correction, as opposed to, just long term prevention.
That you use the word prevention, because I have a lot of discussions, particularly with my mother, when she finds out I'm going to have an appointment somewhere, and she really hates it. But I keep saying it's prevention, it's prevention. However, so the secret's out. There is a little bit of Botox happening, or there was, and because the person who's been taking care of me for years and years has said your body's rejecting Botox now; it's not going to work anymore, and I'm kind of just left at that. So is that a thing? I didn't know that was a thing.
It's a thing. It's a serious thing. My wife is a case in point. She's resistant to Botox as well. You guys are in the same company. She feels like the shoemaker's wife now at this point. She can't get
Yeah.
Botox.
Yeah. So
Um,
like, so if
Legitimate concern where there is some resistance, antibody production, and everything else. And the conversation I'm having with my patients about that is we really need to go for a longer duration without Botox. When we use it, it has to be sort of a higher volume. We can't be doing this little sprinkling of Botox every now and then. And I think that really will create more risk of antibody formation. But it also behooves the companies that are producing these things to try to sort that out, find a quote new body that is resistant to current antibodies.
So are you saying that there's nothing we can do until this happens?
Basically, there's not much we can do aside from, the stuff, thankfully, that has always worked and still works, is like energy-based devices, retinols, things like that to really optimize your skin and improve things. And sometimes just even being aware that, what, I always frown, just constantly being aware that you're doing it, and just sort of correcting that behavior can frequently help too.
I was like, it's not that I didn't believe her, but I was in denial for the longest time. And I was kind of looking for alternatives. And I mean, there's some crazy stuff you can find online. Do you find that you get patients that come and see you and say, I've bought this online, I tried it, and this is what's happened. Can you fix me?
Yeah, and unfortunately, some of those things just can't be fixed. I mean, people have been doing crazy things, like people taking care of themselves, watching YouTube videos, being sold all sorts of craziness. I mean, social media is like the new era of snake oil salesmen. People finding problems and just peddling whatever they can in order to make a buck, and it's a huge, huge problem. Really taking advantage of people who, whether it's they're at their wits' end because nothing is available to them, or alternatively, they're, financially strapped or concerned, and they're looking at sort of the cheapest option to try to make things better, and they're being oversold promises, right? It's a disaster, that, it's a bit of a powder keg that we're seeing sort of unfold in real time. It's a real big problem, and I'm not sure how to address it. I
Yeah.
don't know, governance or screening or any of that is the right thing, but because these people have always existed, in various formats throughout history, we're just making it accessible to everybody now, which is a big problem.
Yeah. I mean, social media is a great thing, and your social media, which I love because you have fun with explaining things and for getting people's attention. I love your Instagram, and I love the little skits because it does grab your attention, and then you watch it and then you're like, oh shit, I need to call him. I almost called you today after I watched one. I love that you do that. But having said that, social media is great for some things if you want a vacuum cleaner or something for your house. But there, like you said, a lot of the adverts for things for your face or your body is not real, but people are buying into them. What do we do?
Yeah, it's a good question. I really don't know. I think part of it is also, unfortunately, one of the fallouts of COVID is people have lost trust in sort of healthcare providers, right? And I think now they're looking at sort of social sort of promotion and social acceptance and likes as a means of sort of guaranteeing results and guaranteeing outcomes, as opposed to sort of talking to people who really sort of understand the industry and know and they're being fed all of these things. I don't think there's really a way around it. I think the conscientious consumer will still have all of these things flooding their social media because they've been targeted ads. They've looked up facelift on Google, and now, all this craziness is populating their inbox and their social media. But I think as long as they are reaching out to a qualified provider and coming in and having a conversation and sort of really going through what they've seen and what's possible and what's real, I think that's the most important thing. I mean, I just don't know what to do with the group of people who are just sort of like, okay, I'll sign up, sell me whatever. Really, it's a huge problem that I'm not sure how to fix.
It is. I mean, we're all aging, but why do you think we don't want to look like we're aging?
Yeah, there's obviously, I mean, we are biological beings that, evolution has always pushed sort of appearance to some extent, right? Like even the way we look for partners, right? Like part of it is sort of attraction based, and not necessarily all of it is psychological, and there's both components to it. So I think it is an evolutionary bias to always want to look your best and be your best, and part of that is aging. Like you don't look your best anymore and you want to get back to feeling good about yourself and looking your best as much as possible.
What do you say to somebody who comes to see you? Because one thing that I often get told by, well, actually, I probably even say it to my friends is they'll say, "Oh gosh, you're really looking tired." So, do
Mhm.
you often get a patient who comes in and says, "I just look tired all the time. What do I do?"
Yeah. Yeah. So frequently, that is something that will drive somebody to come in and have a conversation. And then we'll sort of go through sort of what they're currently doing, what specific feature is really making them sort of look a little more fatigued than other features. And then we try to target it down to, what can we intervene on to get them looking their best and most rested.
What's the biggest misconception people have about facelifts?
That they're gonna look like Joan Rivers, right? That they're gonna look totally windswept and bizarre, and sort of the modern day facelift is not that. It is trying to achieve a very natural looking appearance where they look like themselves, but better.
Right. And I guess when people think of a facelift, they think the recovery is like is hell basically. They're like, "Oh gosh, I won't do it because the recovery is going to be just a nightmare." But it's not anymore, is it?
Yeah, the recovery, I mean, it's still a recovery. It's still major surgery compared to some of the other things we do. It's a big procedure. So associated with any big procedure is a bit of a bigger recovery. That being said, the biggest recovery is really that first week where you're swollen. It's not overly painful, funny enough. There's a lot of numbness because as we sort of lift and elevate tissues, we interact with some of those sensory nerves. So there's a bit of numbness, not much pain, but there's the real swelling and bruising and all of that of having had, a major operation. But most people by the end of the first week are feeling really, really good. Second week, and then they get even better. And it's a very rapid improvement beyond that.
Is there such thing as too much intervention?
Yeah, absolutely. Yeah, we've all seen it, right? I mean, people who look, you should have stopped a little short, right? Like people used to joke around about Michael Jackson, but these days, I mean, that is, for a while, that was the norm. People just looking absolutely bizarre. Thankfully, we've sort of dialed that back a little bit. People are looking a whole lot more natural. So yes, it's, the way in which we sort of do things in our practice is we really, to use that housing analogy, we really want to start with the foundation and gradually build things up. We don't have to tear down the house and rebuild everything in one day. There are meaningful changes that can happen throughout the process. And it's coming up with a long-term plan and using everything in our toolbox that's available to us to actually deliver on each one of those results.
I want to talk about the scar camouflage scale.
Mhm.
Tell me about it, and what made you come up with it, and how did you come up with it?
Yeah, thanks. So this was research that I did primarily as a resident with a whole group of people that were involved in this. It wasn't just sort of done in isolation, but effectively, we're always looking at improving surgical scarring. We're always looking at improving scarring in general. Like, what can we do to make them better? And the reality is that until you have a way of measuring something, you don't really know if it's getting better. And that's where sort of scar scales and interventions come in. So we looked at the literature and what was available. And really what we found was that the current way in which we measure scarring wasn't great. And it was very difficult to sort of get that true relationship of sort of what we're seeing and how we're scaling that and the numbers associated. What's a 4 on a scar? Like, nobody knows what that actually is. And then trying to find a way in which we could find a meaningful change on that scale, quantify it, and then use it going forward. And one of the biggest components of that scale is sort of the overall impact of the scar, right? So if we're looking at somebody's face, you could have a small scar, but it could be in the middle of your forehead or cheek. And now it's blatantly obvious and it has a major impact on your overall life versus, purely just saying, oh, it's a 1 centimeter scar that happens to be elevated or depressed or red. Like, how does that relate to sort of who the person is and how they present themselves? We're able to sort of quantify that a little bit.
And that we can call it a little scar, but to someone that can feel like it's the biggest noticeable thing that they've ever encountered in their life.
Absolutely, right? And it's not, I mean, there's so much tied to that scar, right?
That's right.
To use the example of that patient that I had years ago, yeah, she had a traumatic scar on her face, but the backstory is that this was, related to an assault that she had in her relationship, and she carried that sort of day and the post-traumatic impact of that day every time she looked in the mirror. Right. So if we can make an impact where we can make that look a little bit better, less distracting, less attention grabbing for her, then now we're really able to help her move on from what occurred and feel better about themselves.
What's the most powerful transformation you've witnessed that has nothing to do with making someone look younger?
Yeah, I think, that gets, related to scars. That's certainly one major impact. But sometimes, we do a lot of hair restoration here in our practice. And sometimes, you can have a major, major impact on somebody, how somebody feels and their confidence just by restoring their hairline a little bit, boosting up their density of hair, making them feel, just a bit more comfortable in their skin. And yeah, it just gets at that whole intersection between the psychology and your confidence and your appearance, right? It's really sort of trying to marry all of those things.
That was one of the videos I saw earlier. I met Ted. Is there a difference between removing a scar and helping someone make peace with it?
I guess it's a combination because we can never truly remove the scar, and that's part of the conversation, right? So we can try to make it look better, and we can optimize things, but it's never always gone, right? So to the same extent, like just dealing with loss or bereavement or anything else in your life, it's never gone. You can always think back, and you're flooded with emotions, and you re-experience each one of these things, but it's your experience becomes different over time. The intensity changes relative to each one of those events over time, and your ability to adapt to it changes as well. So if we can help move you along that sort of process, then that's the real impact we're having, is we're allowing you to still experience what's occurred and why that scar is there, but we're able to make it less intense and less impactful on your overall life.
How do you feel about AI technology?
I love it. I use ChatGPT and Claude for everything. It's so good. It planned my last vacation. It's amazing. Yeah, no, I think it's having major, major impact on any sort of copywriting or other stuff. It's great from those things. It helps me sort of fact check things all the time. I use it in lieu of Google at this point just to look things up, things that I've forgotten. I think it's great. There's some limits to it, of course,
Hmm.
but I think we're really sort of at an amazing time where this is something that's available to us until it replaces what I do, and then it'll be
Exactly, exactly. But so yeah, so is there a lot of AI technology to do with plastic surgery?
So we currently use a robot, the Artis IXI, which is a robot we use for hair transplantation. So it helps harvest grafts, and it uses AI technology to really look at each individual follicle, like 60 times per second, pick out the best quality follicles as far as harvesting for hair transplantation. So we're already using that technology. They're integrating some of this technology as well into any of the energy-based devices as far as you know, identifying the patient's individual skin, what is going on with their skin, pigment, other stuff, using that to process and coming up with the best parameters. So really, there's a lot of interesting things happening. And I do think that as we progress down the road with each one of these assessment tools and intervention, I think it'll be better and better. And as long as we're using them as a tool and we're still involved sort of in the thinking and correlating things and humanizing things, I think it's going to be great.
After everything you've learned about faces, identity, aging, and confidence, what have you learned about yourself when you look in the mirror?
Hmm. Challenging. That's a good question. I mean, you learn to sort of accept certain things. You learn to let go of certain things. And then you also learn to modify things that are sort of modifiable, right? So I use Botox too because it still works on me and I can. And this is what I do. And I
You
sort
had
of
to
have
say that, didn't you? Because it still works on you.
Yeah, no, I have to drink a little bit of the Kool-Aid. I mean, I had a first stage hair transplant just to know what that experience is like, be able to talk to my patients about it. And do I need more? Sure, I need a little more hair up here. I want to have the mohawk. It'll be amazing. But yeah, we look in the mirror and we're seeing everything every day, and we're trying to sort of pick and choose what we impact on and what's going to make a meaningful difference. I mean, at the end of the day, it's not necessarily your appearance, but it's how you present yourself to the world, both when you're at work vocationally, but also socially, like how you interact with your kids and your partner and everything else. And, they're going to love you no matter what, and they're happy with you no matter what. And that really, that education comes with time and accepting that. Obviously, when we're in our youth, we're very self-conscious and about every little thing until you realize, you know what, it's really about relationships more than anything else.
Definitely. I like to have the last end of my conversation. It's called Kevjet's quick fire questions.
Oh, man, I'm scared. Okay.
What is the first thing you notice when you meet someone?
When I meet somebody, how they make me feel in that interaction. Yeah.
What's the most attractive quality in a person that has absolutely nothing to do with appearance?
Again, how they make each other feel, whether they build people up, how they interact with others, how they make other people feel in that situation.
If you could perform one procedure on yourself right now, what would it be?
I don't know. A good question. Probably the tummy tuck I've been saving up for. Yeah, or the second stage hair transplant.
What procedure would you absolutely never have yourself?
I don't know. I mean, it's a challenging question, right? Like, I mean, I could say brain surgery, but God, if I needed it, I guess I'm having it. So
Yeah.
there's sort of a need to have and a desire to have. I think I would be open to most things as far as surgery goes. Do I actually think I need them or want them? Maybe not, but I'd probably be open to 'em.
What's your worst habit?
Snacking after hours. Yeah.
Are you a morning person or a don't speak to me until I've had coffee person?
Yeah. Coffee is good.
What song would you play as you walked into the operating room?
I don't know.
And do you do that?
So usually I'm playing 80s tunes in the operating room. I sort of like just listening to that. I don't know if there's a specific song I would walk into, I sort of feel like a wrestler walking into a song. That'd be great.
What's your guilty pleasure?
Diet Coke. Yeah. Big fan of Diet Coke.
I haven't had a Diet Coke for 15 years.
Oh my God.
It was the worst thing. It was the hardest thing to give up. And if it's in my fridge right now, I would still walk past the fridge and look at it several times.
Yeah. It's just one of these things, right? Like it's just so good. It's so refreshing.
It so is. What's something people would be surprised to learn about you?
Um, I guess I've had cancer. I've had it twice, actually, testicular cancer twice. And so they would be surprised by that. Going through that process as a surgeon is different. Experiencing sort of healthcare is different. It allows me to relate to patients differently, having had an experience of radiation, chemotherapy, that sort of stuff. I can speak to it a little bit differently. So yeah, I think that was sort of a really impactful thing in my life, obviously. And yeah, it's just something that a lot of other providers, I guess, haven't had to deal with on a personal level.
If you weren't a plastic surgeon, what would you be?
Probably back to playing with Lego, architecture. I do like that. I love gardening, landscape design, that sort of stuff really is my outlet.
That's one thing you wish they would ban on social media.
All this advertising for random treatments that have absolutely no basis in reality.
Do you find that difficult for patients to trust you?
Yeah.
Because if you're advertising, if you're on Instagram doing those videos, which I love, but how can someone determine that that's real compared to what they're seeing randomly on their as they're flicking through the pages?
Yeah, and quite frequently we, within our social media, we're typically not trying to sell a product or anything like that. A lot of the times our sort of pitch is to come in to have a conversation about things, and that's really where it's at. It's coming in and exploring all the options that are available to you as a particular intervention that may or may not apply to you.
What is your biggest irrational fear?
I hate bees. I hate bees. I think I've thrown an umbrella off of a balcony, second story balcony, because it was sort of engulfed with bees at one of our houses when I was a trainee. I mean, yeah, I don't know why. I just not a fan.
You're an excellent plastic surgeon, but there must be something you're not good at.
There's so much I'm not good at. I mean, yeah, there's so much. I think, I've always been a bit of an introvert. So social sort of interaction situations, especially large groups and things like that, are still sort of anxiety provoking. And it doesn't matter what your accolades are, or what it says on your CV. At the end of the day, you're still that, 6-year-old interacting with people and just sort of dealing with all of the stuff that goes with it.
So true. What's the best piece of advice you've ever been given?
Treat people like you would treat your family. Yeah. I think that's the biggest thing. Skin deep. I mean, beauty is not everything. It's skin deep, and it's not what defines you.
I loved our conversation today. And where can people find you online if they're interested in having the very famous Mike Brandt?
So you can find us Form, Face, and Body. If you just Google that in Toronto, Form, Face, and Body, we will readily pop up. Alternatively, you can follow me on my Instagram at DRMBrandt, Brandt, D as in David, T as in Tom. And then alternatively, you could follow our Form, Face, and Body Instagram as well.
Lovely. And I'll post all of those on underneath our episode, and people can easily just click on it and find you there.
Perfect. Thanks so much. Thanks for having me on the show today.